right, time now for Better Pets.
We are tackling two topics today, pets and Thanksgiving, and those lumps and bumps that you sometimes find on your pets.
Our Better Vet, Dr. Andrea Dennis, is joining us. My cat Dash has bumps all over him, but prior to knowing you, I took him to the vet, and they said that the bumps were benign, but I was really concerned about that.
You're talking about a cat.
A cat.
Right, you're right.
Yeah.
Most growths on cats are benign,
okay.
But still it's always worthwhile checking, like having the veterinarian check them out. And one of the things that you can do at home is actually go over your pet. And a lot of times because of the long hair, you don't see those skin bumps. You don't see those different things. So I even have one that's right sitting here right on my lap. And see how that long hair, if you had sort of growths here, you would never find it. So always pet them on a regular basis. And if you feel something slight, then go back.
So let's talk about the types of growth.
Sure. We've got, most of the times there are non-tumors. Those are the most common growths. So we have cysts and warts and hair follicles that sort of rupture. Then the tumors we put into two categories. Either they're benign or they're malignant. And most people assume every growth is going to be malignant or cancerous, and that's not the truth.
Just like in humans.
Exactly. So you don't want to be afraid to go ahead and present that to your veterinarian, but at the same time you don't want to ignore it either. I think that's very critical. So when your veterinarian sees this, or you point it out and you see one or two, then the first thing we do is check with a needle biopsy.
Okay.
And that does not hurt whatsoever. A needle biopsy is where we put a small needle into the growth, draw a few cells, and then we look at that under a microscope and send it to a pathologist. And then we have a plan. Then we know what we're going to do.
Or an impression.
There's called an impression smear. Sometimes tumors that have been lingering for a while will sort of rupture and ooze. And sometimes the best thing to do is what we just call an impression smear, and we can get a little bit of information on that too. But your veterinarian will make that decision. And once you know what it is, then you need a plan. What are you going to do?
Yeah, what are you going to do?
Most of the time, there's two different schools of thought. I tend to like to remove growths as soon as we see them.
Regardless if they're benign or malignant?
Well, yes and no. I mean, I think certain cysts I'm willing to watch, but even cysts, which are not cancerous, will rupture. And when they rupture, they cause more damage.
Okay.
And especially if you can do it without putting your cat or dog under anesthesia, and there's ways of doing that. So I'm okay about monitoring for a little while, but most of the time I really do think it's recommended to remove most growths.
Okay. I have some pictures because actually our producer Tracy, her dog, went in. There's Jake. He actually looks quite happy after his surgery. He had 2 bumps removed. Maybe he's happy now.
I think and there you can see his incisions on the back. He's actually had 2 of them. And so they've been watching those growths for a little bit, but the key thing is one of the growths changed. It started to change its appearance, and that's when they knew it was time, let's go ahead and remove it. So he went under anesthesia. He's 9 years old, but he did very, very well. But again, at the same time, he's recovering. He's not the Jake that we all know.
And does he understand the cone of shame is there for his protection?
They do. They tolerate it.
Okay.
But they can do so much damage to their incisions if they don't have that collar. That's really the best thing to do. So
we've got some pictures too of lumps on dogs that we need to be watching for.
Those are actually cysts. Now with this dog, I would just go ahead. They look a little bit different. One's oozing, the top one's oozing a little bit. So you can just give this dog a little light sedative and do what we call a local nerve block. You don't have to put this dog under anesthesia, and you can remove them. And that's the best way to handle it with no risk, because a lot of people are afraid of the anesthesia.
All right, now Kara and I are cat people. We actually got cat bumps.
Yes, they will get their lumps and bumps. That's actually a cyst.
Okay.
Now that's only going to get bigger
above the eye there, right?
Right,
okay.
right
I had a
above
cat
the
who had
eye.
one of those, and they told me to leave it because they said it was nothing really. It was tinier than that. But
right. If you can't draw the fluid out now, but see now that cat is actually you got a growth, and see those scratch marks.
Yeah.
So yes, you leave it there, but eventually it probably is going to cause them uncomfortableness. So you can see that cat scratching at it. So we definitely have to go ahead and remove that one. That could even possibly be done under a local.
Oh my goodness!
Now, see when you wait too long. Those are because most tumors.
This is horrible.
It is. We can take that picture off if you want. But that was what we call a fatty tumor. The most common tumor we find in dogs are fatty tumors, and again we can watch them, but watch them closely. Many times they start off like really small, like the size of a walnut, but they can get to the size of a grapefruit, or that size if you just don't do anything about
large
it.
watermelon.
I know.
Yes.
All right. So thank you for good information on that. Now, we've got Thanksgiving coming up. Speaking of fatty tumors, a lot of fatty foods around. And cats, I feel like, you know, they just want to crawl on the table, and the candles are their biggest danger, but the dogs want to eat everything.
They do. And sometimes you're so busy with so many people in the house that you're not always paying attention, but don't just slip a little bit of gravy and put mashed potatoes. No, don't do it, Scott. Don't put it on the floor. And because all that fatty stuff can cause a lot of GI upset, something very serious called pancreatitis tends to be occurring after a large fatty meal. So don't give them
Not
anything.
even a little nibble. Nothing. All right,
I would recommend nothing, because then people don't know when to stop.
All right.
Diet and exercise?
Yeah, please don't ignore them, because again, if we've got a house full of people for 3 days and they're not getting outside, of course they're going to get into trouble. So you exercise with them, keep their diet the same. No giving them little bits here and there.
Bones are dangerous?
Absolutely. So put those all away. People like to save the carcass because they're going to make soup. Just put it high so your dog can't get into it, or your cat. Now, a lot of people don't realize that onions and onion powder can be extremely dangerous.
Really?
And what's that? And most of the time onions are put in stuffing. It can cause a severe anemia. So again, that's why you don't want your pets involved in those things, okay?
Grapes and raisins?
You know better.
Yeah.
You guys know about this now, right? Those can cause kidney failure, and we just need to keep those away from people. And people think 1 or 2 is okay. None.
And a big no-no, chocolate, especially as we've learned from you many times, baker's chocolate can be deadly.
Very good. Exactly. So, you know, and again, through the holidays, we're going to be dealing with chocolate and candy, but please stay away from that. I've had this happen already, where they get into the wrapper. So even though you're not giving the gravy, they'll go into the garbage and they find the gravy in there, and then they'll eat the wrappings too. And that causes an obstruction, and they have to have surgery to remove it.
And keep them away from the garbage.
Yeah, look at that picture. I think that's adorable.
Keep it away. They're like, it's my plate.
They will get into so much, but watch those things. Just be very diligent.
Get a turkey-flavored dog food. You know what I'm saying?
Or put, a little chicken broth on top, and then that's their treat for the holidays. I mean, I'm not trying to be mean. I'm just trying to keep them safe.
All right, as a reminder, Dr. Dennis is the owner of the Bloomfield Animal Hospital on Old Windsor Road in Bloomfield.
All right, and she's also on alternating Saturday afternoons from 2 to 3. She takes your listener questions during Pet Talk on WTIC 1080, so tune in if you can. Thanks, you, Doctor.
Doc.
Oh, happy holidays.
Happy holidays.
Happy Thanksgiving.
All right, on this Veterans